Hi, and welcome to the Senior Network. I am thrilled to be here today, and we're going to talk to Rejuvenate Healthcare, which I'm really, really excited to talk about. Bradley Morris, thank you for joining us today.
Thank you.
Dr. Moshe Dekel, thank you for joining us today. Did I say your name right?
Yes, you did.
I've been practicing that, so that's really good. I'll tell you what, we've had about 20 minutes to really visit before the interview. And like we talked about, background is everything. Really kind of knowing the foundation of how you got started has really been interesting and sort of brings everything full circle. I'd like to talk a little bit about functional medicine with you first,
Sure.
and then talk about some of the tools that you actually use in your practice.
Sure.
So
What would you like to know about functional medicine?
Well, I think basically, let's talk to people about what functional medicine is, because allopathic medicine, homeopathic medicine, you've experienced
Yes,
both.
yeah. It's a great question. Allopathic medicine, obviously it's conventional medicine. I was trained in it. I used to be a surgeon and an OBGYN. And about 20 years ago, my neck and back decided we really can't do surgery anymore. So I opened the door to what I call the real medicine, which is functional medicine, which means what? You look at the functions. Okay, we look at symptoms different than the allopathic medicine.
Correct.
Allopathic medicine is here to kill symptoms,
Correct.
pain, etc.
Correct.
We interpret it to say, okay, why do you have the pain? Where's it coming from? What function can be and should be addressed? And therefore heal the body, help the body heal, because the body is an incredible healing machine. And get rid of the symptom that you came in to begin with, without using medication, obviously.
Which is so interesting. What are some of the things that you all do in your practice?
So there's a wide array of things that we can do because we collaborated together. You know, when we talk about functional medicine, he's exactly right. We're looking at the functions. So one of the things we'll look at blood panels. We may look at hair analysis, hormones. We're going to look at the whole body. And the main thing that I try to tell all my patients is like, listen, I'm going to treat you and nobody else, just you. So we're really looking at that individual, trying to find out what is their problem, what's the why. Because once we can find the why, then we can address it. And so we use things like ozone therapy, ultraviolet light, regenerative medicines, anything from stem cells to PRP to prolozone to procaine, dextroneural. We do homeopathic. It's called field control therapy, which is it's really cool because it was developed by a cardiothoracic surgeon.
Of course.
So when I'm explaining something about homeopathy and I tell them it was developed by a cardiothoracic surgeon, they're like,
What?
What the hell?
How did that
Exactly.
happen?
Well, one of the tools that you're really proud about, and we want to make sure that we share with the folks who are watching today.
Well, it's the latest thing we brought into the office, and it's called Synexus. Synexus is electrotherapy, and then a lot of people have had electrotherapy. They may have had a TENS or a muscle stimulator, a Hockermed.
Okay. That's what it is.
That's similar.
Okay.
All those devices will have a high frequency or a low frequency or a medium frequency. What Synexus did was they said, okay, I get it. We're going to have a high, medium, and low frequency, and then we're going to have a frequency and amplitude modulated. All that means?
Yeah, what does that mean?
That just means we're covering the full spectrum of electrotherapy.
Okay.
So what it allows us to do, it's going to allow us to affect the cardiovascular system as well as the neurogenic system.
So if I have a client, that's what I was telling you, I have a client who called me ironically the other day and said, I really need functional medicine doctors. And when it was fascinating, because who typically would come to you, and what would help you in your treatment of them? What kind of information is really helpful for you?
All right. We have two types of patients. Patients who know a little bit about holistic medicine, they say, that's the way I want to go.
Okay.
But the majority of patients, at least in my side of practice, are patients that have seen 5, 10 doctors without relief.
That's exactly
And that's
right.
what you and I talked about before.
Yeah, and it's the people that are hopeless, right? They've been everywhere and they've been told all these things. And one of the most common things I hear all the time is, well, my doctor just told me my lab was normal, and I'm like, it ain't normal.
Yeah.
It's not normal.
Right.
Because it's not normal to feel this way.
That's right.
There's something
That's
going
right.
on if you don't feel good. And unfortunately, a lot of people don't know what feeling good is.
Yeah, if
And
they don't
so-
know the baseline.
Yeah, so these things have crept up on them so slowly that they feel miserable and they think they feel okay.
Well, I think if we've done nothing else today, it's to basically tease our views into learning and knowing more, because knowledge really is power, and I think you all have a tremendous message to share and tell, especially in this day and age. So I want to thank you both for brief
Brief,
but
very brief.
enlightening interviews. Stay with us. There's more to come.